Good morning and thank you for joining us for State of Texas In Depth. I'm Josh Hinkle. This week we are taking a closer look at some of the big issues facing cancer in Texas. Thousands of Texans die from cancer every year. This session, one lawmaker says he can lower that number in one form of the disease. He points to overwhelming evidence that giving boys and girls the HPV vaccine around when they are 11 years old can help prevent the human papillomavirus from spreading. HPV can cause several different types of cancer. KXAN's Phil Prazen explains how a new bill could help save lives in the future.
Busy day here today.
On her first day at the clinic for medical school, Dr. Deborah Patt saw a woman dying from cervical cancer. Time went by, 20 years later, and not much has changed.
And you know, I'll tell you, I've seen young women die of head and neck cancer that is HPV related. And think to myself, this is a preventable disease.
She says her files of patients with cervical, anal, head and neck cancer could have been stopped with a shot already available.
It's frustrating because I think, you know, we need to make progress in cancer. So when we have made progress in cancer and it's not implemented effectively, it's a real challenge.
Simply put,
a bill by Representative John Zerwas hopes to educate and improve availability of the HPV vaccine. He laid out the idea to the House Public Health Committee.
Because the science is pretty much done here.
CPRIT, the health department, and healthcare professionals would give recommendations to the governor in the hopes of creating state policy to encourage people to get shots.
To heighten awareness.
Dr. Patt says most of the battle comes down to parent awareness.
While parents have every right to decide what is right medically for their children, most parents are going to want their children not to have cancer.
Children that someday as adults could have lower death rates. Phil Prazen, KXAN News.
The work group this bill would create would give their recommendations to the governor next session, so in about 2 years. Representative Zerwas says this bill would not cost any extra money. No one has testified against the bill yet. HPV is the most common sexually transmitted infection in the U.S. More than half of sexually active people will have the virus sometime in their lives. It can also be deadly. Nearly 10,000 people died of HPV-related cancers last year. According to the Texas Medical Association, Americans are falling behind when it comes to taking the HPV vaccine. Right now, only 32% of Americans have received the vaccine. In comparison, 84% are vaccinated in the UK, 81% in Portugal, and 75% in Australia. Despite those numbers, former Governor Rick Perry admitted it was a mistake to order Texas girls to get the HPV vaccine in 2007. Back then, the order outraged many Republicans. Some thought it would encourage promiscuity. In the end, the order was dropped. During Perry's run for president in 2011, he said he should have gone through the legislature before trying to force the order. One proposal in the state Senate will cut off state and federal funding to Planned Parenthood for breast and cervical cancer services. Our media partners at the Texas Tribune report the budget will prioritize programs at public health clinics with second priority for private comprehensive care. Private specialty clinics like Planned Parenthood would get money only if there is any left over. Critics say the changes disproportionately affect low-income women in rural and West Texas, so is that true? The Tribune published this map that shows public and private providers. The orange dots are providers, the public providers, like community clinics at UT's nursing school in Austin. Purple dots are the private clinics, which include Planned Parenthood locations, as well as 34 other providers. If this proposal goes forward, there would likely be fewer providers between Austin and New Braunfels, and in the Panhandle, there could be no providers. You can check out this map for yourself. We'll include a link in the politics section of KXAN.com. And something else we're keeping a close eye on, what appears to be an about-face on plans to consolidate several public health and human services departments in the state government. We reported last summer how the Sunset Advisory Commission wants to merge 5 agencies into one mega agency that includes the Department of Aging and Disability Services, as well as the Department of Family and Protective Services, which oversees foster programs as well as daycares. The proposal was to merge those agencies together in order to streamline administration and cut costs. But a recent scandal over contracts at the overarching Health and Human Services Commission has lawmakers rethinking that strategy. On Wednesday, State Senator Jane Nelson proposed a slower transition. According to the Texas Tribune, lawmakers are scrutinizing $110 million of contracts outside normal competitive bidding processes. Last year, HHSC sued contractor Xerox for mishandling the Medicaid operations. Cancer politics in the state capitol. We take a look at some of the plans that could save lives but may be controversial with our roundtable. Dr. Deborah Patt, an oncologist for the Texas Medical Association, and Alana Rocha from the Texas Tribune when we return. Welcome back to State of Texas in Depth. This week we are taking a closer look at health care and cancer care in Texas. Our roundtable follows these changes closely. Alana Rocha from the Texas Tribune and Dr. Deborah Patt, an oncologist who is a member of the Texas Medical Association's Committee on Cancer. Thank you both for joining us.
Thanks, Josh, for having us.
Thank you.
So we were talking about Dr. Zerwas's bill in the House earlier in the show. This is something that both of you have been following closely. Alana, I know that you had peeked in on the committee. Exactly what's happening with that bill? Is this actually going to be something that the state is going to be doing? The State Health Department, CPRIP, partnering up to inform people about cervical cancer and HPV.
Well, he had a bill this week in a public hearing or public health committee, and it was left pending in committee. We didn't hear any testimony for or against. There were a couple of people registered, but nobody spoke. It seemed to, not face any criticism, but the chairwoman did make sure that this bill in no way mandates for people to have to get the vaccine or have to give their child the vaccine, and it does not. It just kind of calls on Department of State Health Services to create a strategic plan, and it would be up to the next legislature to act if they decide to do so.
And that plan would include a lot of education and awareness and access also to that information. I guess that, a big part of what they're talking about is the potential controversy that surrounds HPV and cervical cancer and the Gardasil vaccine. Is that something that the Texas Medical Association has been working to maybe alleviate the concerns of parents and medical professionals out there?
We have. This has been a high priority for the Texas Medical Association because, what we've seen is that the Gardasil vaccine was approved in 2006, but still utilization rates remain very low throughout the United States, actually. And it's a problem because, when we need to see, advances in cancer, when implementation of advances that we know prevents cancer doesn't occur, it's a challenge. And so I think there are a couple barriers that we recognize to appropriate use of that vaccination. I think one is that parents really have a fear of a mandate, and to your point, there is no mandate for vaccination. Certainly it's a parent's own choice. Whether or not they decide to administer the Gardasil vaccine to their child and protect them against cervical, anal, and head and neck cancers. And then the other issue is that I think sometimes there is the perception that if parents protect their children with the Gardasil vaccine, that it's an endorsement of sexual promiscuity at an early age. And so certainly that's not true. It's a public health issue. And so I think that there have been barriers to appropriate use. And the Texas Medical Association has had a priority to educate around this, and you can see on the TMA's website information about this to try to get information out. But again, it's been, the use in the United States has been low, and the use in Texas has been low. So, so we know there's opportunities for improvement, and I think Dr. Zerwas's bill is very timely.
You were in our story that we had earlier in the show, and you definitely dealt with parents on this issue. We talk about education, but how easy is it to actually convince them once you've laid out those facts?
I think it's hard because, this, as an oncologist, I see patients when they already have the cancer. So that's probably a 10 to 20 year delay from when they actually incur the virus, right? Whenever they acquire HPV. But where vaccination occurs is in a pediatrician's office. And, a pediatrician in a well child check, especially for children ages, in the 9 to 15 range, in which the Gardasil vaccination typically is given between 9 and 13, but can be as high as 26. But this is usually in a pediatrician's office. In those years, when children on average are seen about once a year, there's a lot of things to cover in that time. So do you have adequate time to address all of those important concerns? Probably not, and probably there's a role for wider public awareness. That's why, Josh, I'm so grateful that you all are doing this story to try to heighten awareness that HPV does cause cancer and it is preventable with the vaccination.
Now, I totally understand parents' concern about a mandate for that vaccine. You know, this has been talked about as a requirement to have this vaccine because of the stuff that Governor Perry backed in the early 2000s. This even came up in the last time he ran for a presidential election. It could come up again if he decides to run for president again. How does that kind of thinking actually hurt or help this argument?
Well, I think that, you know, as parents, I'm a parent of 3 children, you know, we have pretty strong beliefs about what should happen with our children, be it with their, you know, moral upbringing, their education, how we treat them medically. And so it is a problem, I think, when people infringe upon that, really to give mandates. And so it's very tricky business. And that's why I think that it's clear at this point that it's a recommendation and that it's not mandated. Because you know, I think that the perception that this mandate, you know, could have happened really has caused a backlash, and really probably fewer people at this point are vaccinated than maybe would have been.
And Alana, we heard about that in the last presidential campaign. As I just said, do you feel like it's going to pop back up again, and how could that affect parents' thinking?
There is a potential always. I mean, to kind of, Governor Perry has, what, 14 years of a record as governor to look back on. This was a sticking point early on in his campaign last time around, so you can expect some level it'll surface again, and that it could impact or kind of resurface that stigma that came with the vaccine and his executive order back in 2007.
I understand the reasoning behind it, but some people might argue a vaccine would be the best, or a requirement for the vaccine would be the best thing.
I think it's hard to make mandates on what people do with their health. I think that's very tricky business of you know, personal autonomy and paternalism of the state. So, and especially in Texas, I think that, you know, we're probably a little bit more liberty driven than other places. So I think that's always going to be very tricky here.
Alana, Dr. Zerwas's bill would actually partner the State Health Department with CPRIT, the Cancer Research and Prevention Agency that has come under fire so much in the last couple of years. Do you feel like trying to get an important message out there, but keeping that message with a name like CPRIT is going to hurt this cause?
I don't think so. In talking with Wayne Roberts, the CEO of CPRIT, he feels like there's no cloud over CPRIT, that they've you know, been very transparent since what came to light a couple years ago with how they awarded a grant. So I don't believe so. I mean, 10% of CPRIT dollars go towards prevention, and that was a focus of our story a few weeks back, and just how if these dollars go away, the state dollars, it's not just about research grants and looking to the future, it's about treating people who are dealing with the disease now. So I think it's a great partnership, a great resource in crafting this plan if the bill moves through.
Alana, we mentioned this earlier in the program, but the Texas Tribune has just launched a special web feature that is all about cervical cancer and HPV. Kind of telling me a little bit about that.
Right, it's a map looking at the cervical cancer and I believe breast cancer providers in the state, and just a good resource for people to check out to look to see in our large state which one might be near you.
Great, and we will have a link to that Texas Tribune feature on our website at kxan.com if you will look for this story about State of Texas on our main page, kxan.com.
If individuals also want other information about HPV and the vaccination, the TMA also has a link to their website. So
great, we'll put that link on our website also.
Great.
Thank you both for being with us. I appreciate it for this very important topic.
Thank you.
All right, and thank you for joining us for State of Texas In Depth. Remember, you can join us every Sunday morning in the 8:30 half hour for a broader look at Texas politics. Stay tuned for Meet the Press coming up at 9. I'm Josh Hinkle. Have a great day.